All right, good. So today I wanted to go over with you, there's some good news about gingivitis and about periodontal disease that I want to share with you. In earlier segments, I've gone over with you different things that what gingivitis means, periodontitis means. Those are words that refer to inflammation. Anything with itis after it means inflammation of the word before it. So gingivitis is inflammation of the gums. Periodontitis is inflammation of the structures around. Perio meaning around, dontal meaning the tooth. What structures are they? Just as a review, we have bone around the roots. Of course, we have our root. We have the nerve and the pulp. That's where, when the tooth is born and growing, there's this massive blood supply that comes in from down below, and we fill that, and it helps to feed that tooth so that it can continue its growth. And it has three. It has the nerve going up through there, has a blood supply that goes in, and the venous blood supply that comes out. So there's a constant flow, and it pulses material, fluid in solution into these dentinal tubules. Kind of a flow like this. You can see the little arrows I'm drawing. So it's fluid in, fluid out, fluid in, fluid out. So it keeps the tooth supple like a healthy tree branch. You can bend it, it won't break. So that's the anatomy and how the tooth works. Of course, we have the hard outer shell, which is the enamel. So with periodontal disease and gingivitis, where this attack begins is right around the gum that is around the bone and around the tooth. That gum fits around the tooth and the bone like a turtleneck, where you can actually take your finger on a turtleneck and feel down around your neck if you get, a scratch or it's itchy. But it's attached tightly at the base. And we call that the attached gingiva. So over the bone, just above the bone and then over it, there's going to be this attachment, and it is tethered in place. And the purpose of that is to prevent bacteria from going down through what we call the little area where, when you have your gums measured, they check for pockets. Inside this little bit of gum that pops up from above, that then covers the bone, there's a slight opening in there, and it's called a sulcus. And a sulcus just means like a furrow or like a little ditch, basically. And the purpose of that, of course, is to keep fluids and flush out bacteria, etc., in this open sulcus area, and to allow flexibility with your teeth and gums. Otherwise, you would be able to chew, but you'd have to chew like this. You could barely move your lips and gums. There has to be stretch. And that's where that comes into play, and some other different areas of the mouth that allows there to be stretchiness, etc. So this has to stay healthy. Now, once the bacteria get down and they start breaking down through this attached area, then it infects the bone. And it basically causes a whole inflammatory response, and then the body goes haywire. As in an earlier video, I talked about it being an autoimmune response. The body then says, we have to get blood vessels in here to bring white blood cells and other killer cells to take out these harmful bacteria. But it overdoes it, and it begins tearing down all this bone, and then we start losing bone around our teeth, and they get loose. Once they start getting loose, we don't have a solution for regrowing the bone. So we want to catch it before it starts breaking down through here, or we want to catch it in its early stage so that this can be somewhat reversed. Just to illustrate again, gingivitis is just barely beginning in the gum. That's the best time to catch it before it becomes full-blown periodontitis going into the bone. So what are the things that we can do? I'm going to illustrate those here. So number one, this is probably not going to go away anytime soon. Contrary to sometimes things that you'll read or see on the internet, there's some that say, oh, you should never brush. There's some that say, oh, you should never floss. Well, here's what happens with bacteria. They want to live too. So they've figured out a way to grow and live in our mouths. We have over 1,000 species that live in the mouth, and that we know of thus far, and they live. And so it's a bit symbiotic. It means they survive, we survive. As long as they don't cause illness with us, then they're good, right? Symbiotic. So The real problem is when they get out of balance. What do we do when they go out of balance? But if we brush our teeth and floss, all that happens is it takes 24 hours for the bacteria to come together as a big enough group to form a damaging, almost like an organism all by itself. There's so many of them come together, we're talking millions and millions, maybe billions. It takes 24 hours, they come together, and then they finally go, okay, and they start laying their acids down in inflammatory markers, which begins to then break down the gingival area, the gum area, and then they're trying to get further in. Why are they trying to do that? They're trying to hide. So we have to catch them, clean it out, and then prevent them from growing in bigger numbers, at least the harmful or pathogenic ones. So by brushing, we knock out, we break apart that whole group, but we're not going to kill all of them. It's impossible, because a lot of them we need. There's some bacteria that take nitrates in our mouth, and they convert those to nitric oxide. It's the main way that we get nitric oxide into our body, which is beneficial for the lining of our arterial system and all of our cardiovascular system. So we don't want to take that away. And in fact, there's certain mouthwashes that may suppress them so much, people as a side effect are reporting high blood pressure. So we want to have natural ingredients that can suppress the harmful ones while we allow the good ones to grow back up. Mechanically, what we do is brushing, we break them apart. They go into apathy, they go, oh wow, what are we going to do? It's Groundhog Day for them. They go, well, let's all get together again. So they do, but it takes them 24 hours. Well, just in time, hopefully you're going to brush again. Actually 2 or 3 times a day is even better, but let's say it was a whole 24 hours. You break them apart again, and they can't form enough of a group to be damaging and harmful. But they get smart. So what do? Let's say you're brushing your teeth really well every day. Where are they going to go? Where are they going to hide? I asked that question to you. And probably after a moment of thinking, you would go, well, they're going to go between my teeth. That's right. So they hide between the teeth. Well, the only thing that we know that can break them apart between the teeth is the next thing we want to do, which is flossing. If you do it and you love it, awesome, keep doing it. If you haven't, you got to do it for at least 3 weeks, and then you'll learn to love it because your mouth will feel much fresher. So all we're doing is, these two, we're kind of doing a dance with the bacteria. We're kind of keeping them from forming a harmful enough group to lay down their harmful acid byproducts that can create inflammatory responses, cavities, and gum disease. The other mechanical thing that we can do is called a tongue cleaner. And the tongue cleaner, actually, there's a way of scraping toward the back of your tongue gently so you don't harm the papilla that form back there. You clean all that junk from postnasal drip overnight that can form, which is loaded with a lot of noxious, harmful bacteria and the bad breath causing bacteria. So you clean those 3 things out. Now you're doing all the mechanical things that you can do. But I have another thing, and it comes from my company, Great Oral Health, and our team. We put together a product that's actually been around for a while, but we finally had it tested, and theoretically I knew it would break down a lot of the harmful bacteria because we saw it on earlier videos I made where I showed people, we took plaque samples and we could put a little bit of the OraRestore essential oil there and we would see it wipe them out like a tsunami. But I wanted to further test it, so I just got the studies back from overseas. It blew away the researchers, and it did exactly what theoretically we thought it would do. So along with your mechanical things, what's the other thing that you can do? Is you can use the OraRestore essential oil. I'll just put it as EO for essential oil drops. And you can do that a few times a day because that will break down the bacteria that cause these harmful reactions, both with tooth decay and with gum disease. And as a matter of fact, I'm going to share with you some of the studies, some of the results of the study that came back. Now, we tested about 9 different bacteria that are associated with gum disease, both chronic and acute, and gingivitis. And some of these graphs here, what they're going to show, they're going to illustrate, for example, all the way to the left is at full concentration against these bacteria. How well did it kill or destroy them, and how wide did it spread out? So without getting too detailed on this, you can see at 100% concentration, when we start dropping it to 50%, 25%, et cetera, all the way down to, I believe it's 0.5 or 0.05%. With this particular type of bacteria, which is associated with chronic and acute periodontal disease, we call it AA for short, because if you can see the word here, who wants to pronounce that? I don't. But it stayed at 100% kill rate on those, even as we kept reducing the concentration. So a lot of times you can take the essential oil, the OraRestore essential oil, I carry it around in my pocket. You can take it, you'll even see how I do this, put a drop on your finger. It can be clean, or you can wash it after or before, and you just rub it around your teeth and gums. You can do a couple applications, and it's very strong, minty flavor, but it's super fresh. You'll have, and you put it on the back of your tongue too. You'll have super fresh breath for well over an hour. And then I just put it back in my pocket. The women can put it back in their purse. It's very easy to carry it around. But here's what it's going to do. Here's the good news. It'll bring down this population of this bacteria. Here's the next one here. This is fungus, or some people call it candida. Candida, it blew it away, even better than the medicines that are used for candida. The researchers couldn't believe it. All natural product, and it was wiping out the fungus or candida in the mouth. We go further down here, other bacteria associated with periodontal disease, same way. It's knocking out up to 100%. If you can bring this up this way, scroll this up a bit, good. Now there's another one called P. gingivalis, same way. P. gingivalis, a very, very noxious, nasty bacteria associated with chronic and acute gum disease, especially a periodontal disease where it's getting into the bone. And it can be very resistive, so you have to go on systemic antibiotics and many rounds of things. Now, if you take a lot of systemic antibiotics, it's going to wipe out all the good bacteria in your gut too, which can lower the immune system. Well, this is an autoimmune response, so we don't want to be lowering the immune system. We actually want to upregulate it. So by using natural ingredients that you'll find in the OraRestore essential oil, you'll get that result. And now we have the studies to back it up, which was exciting for me, because theoretically I knew it would happen, but it was great to validate it. Then we have the next one here, which is another one. It's reducing it same way, doing beautifully. Let's scroll here. Two other forms of the different types of bacteria associated with gum disease. Again, at high to less concentrations, wiping it out. This is Streptococcus mutans. Just a fancy name for the bacteria associated with tooth decay. At super high concentration, it's knocking it down about 60 to 70%. But at 50% range and less, it's kinder to that bacteria, which is okay, because even though we want to reduce the cavity-causing bacteria, we don't want to reduce them so much, because they're in the Streptococcus group of bacteria, and the Streptococcus group of bacteria are associated with converting the creating the nitric oxide in our body. So we didn't want to fully suppress them. Fortunately, the formula doesn't do that. So it's a good alternative mouthwash that won't create hypertension or high blood pressure, but still control these bacteria. And then if we go further this way, we have another one, Streptococcus sabrinus, another fancy name, but it's also associated with tooth decay, and we see that one coming down. And then we have this last bacteria. It reduces it about 20 to 30% at varying concentrations. We'd like to see higher, but this is a very, very rare. It's T. denicola. We see it in very rare forms of periodontal disease, but it's probably still enough to allow the body to heal itself. Now, these are what we call in vitro studies. In vitro just means that they were done on petri dishes, test tubes, in a controlled environment, so we can see how they respond by placing these bacteria there in controlled concentrations. We could see actually how they did or didn't do. So then we'd have to extrapolate from there and go, how would this do in vivo, which means in the body, in a live living system. But we could postulate that it would transfer that same type of inherent natural antibacterial coverage, but not suppressing it so harshly like the medications that are out there that can also wipe out all the good bacteria. So the OraRestore essential oil is great, huge, big news for those that are suffering from gingivitis or periodontal disease. And as I mentioned earlier, over 50% of adults 30 years of age and older have some type of chronic or acute periodontal disease. The thing is, it's the silent disease of the mouth. It's like diabetes in the mouth, because you don't know it until all of a sudden it gets really inflamed or the tooth gets loose. And at that point, it's too late. So you want to make sure you're doing the brushing, the flossing. By the way, brushing should be done, in my opinion, 3 times a day. It keeps the mouth fresher, it keeps those bacteria under control. And the only caveat with brushing is, after you've eaten a meal, just wait 20 minutes before you brush. And the reason why is, if it's an acidic meal, it'll break down the outer layer of the enamel slightly, make it sort of plastic or pliable. So leave it alone, swish your mouth out. You could floss if you want. If you floss 2 or 3 times a day, it's not going to harm you. Actually, it's probably even better. However, if you leave that alone to let it remineralize for 20 to 30 minutes before you brush, then you can brush. And that's the only caveat with frequent brushing, and always, always using a soft or ultra soft toothbrush. Now remember, where the gum fits around the tooth, it's like a turtleneck. It fits tightly around there, and there's a slight opening around that turtleneck. That's the sulcus. That's what you need to clean with the toothbrush. The rest of the tooth is fairly self-cleansing, which is awesome. After the age of, let's say, 18 to 20 years old, pretty much all the little nooks and crannies have sealed themselves in with calcium, and they've completely mineralized. So later I'll talk to you about another exciting development we have in a toothpaste that's all natural that helps now to remineralize the teeth. So stay tuned. I hope you enjoyed this video. Thank you.